you are a surgeon, a gynecologist that treats patients with endometriosis and fibroids, but you also had lived that experience as well.
Yes.
Was this before you were a surgeon, or?
So it actually was kind of like right in the heart of me deciding what I wanted to do with my life and my medical career. I was actually in medical school when I was diagnosed, and it was whirlwind from there because I had absolutely no idea I had fibroids and endometriosis. Yeah, it was crazy.
So I also had fibroids and endometriosis. I found out 2 years ago, and I'm just so curious. Like, what were your symptoms? What made you proactive to do something about it?
So I actually didn't have symptoms initially. I woke up with pain one day, and at the time, my husband, now fiance, then said, okay, that doesn't seem normal. You don't usually complain. Go get it checked out. Because a lot of times we leave the men out of the conversation. A lot of times we don't ask them, how does this make you feel? Or, what do you think that your partner is going through? Or how do you feel like you could support them? Because we think about them, right? We're like, oh, we don't want him to think we're weak, or we just don't want any this week, or we almost suppress ourselves to please them, but they're a part of the equation too. So yeah, that was that was how he got here to be my husband today. Because of his push.
You were like at the altar, and you're like, remember when you helped me through my fibroid journey? That was when I knew.
Right? And that was the beginning. It was, to just elaborate, it was actually a quite scary experience. I was diagnosed by my nurse practitioner. I had just had my annual exam 3 months earlier, and the doctor said nothing. Didn't say your uterus is enlarged, nothing. He asked, do you have any problems, issues? Felt around, did a little pap smear, and he was out. And when I went and saw the nurse practitioner, she was like, oh, maybe it's your fibroids causing your pain. I was like, What fibroids? What are you talking about? No idea. And my uterus was 16 centimeters at that time. So yeah, Wait. It was more than 3 months pregnant.
So I brought out my measuring tape. What is the size of a typical uterus?
8 centimeters.
8 centimeters? Okay.
8. So like your fist, the size of your fist.
Oh, wait, this is 8 inches.
Yeah. I know.
Oh my God, my fist is so tiny.
Like a fist, right? I know, it's tiny.
Okay.
It's tiny. Can you imagine 2 times, 3 times, 4 times? I have women in here whose uteruses are 30 plus centimeters big.
So this is 18 centimeters right here. And that's how big your uterus grew to.
Yeah. Yeah. Yes. And I never knew it was there. I never knew it was even an issue. Like, most people will have heavy bleeding or some type of pain or discomfort, urination problems, back pain. Yeah. I had none of that. Once I found out the diagnosis, I started to have every symptom there was. I started to bleed excessively, and this is horrible. It was a whirlwind. My diagnosis wasn't typical of how most people will find out they have fibroids.
I never counted the number of pads, the type of pads. I got the Flow app, and it got to the point where I ate full Diva cups plus 6 to 8 soaked night pads in one day.
Oh yeah, that's a lot.
That's
like, how are you standing up? Yeah.
And I was like, I think this is okay.
But most women will come in and they'll say, I've always bled this heavy. And if I said it to my mom or my grandma, they'd be like, okay, we all bled that heavy. That's nothing. It's just part of being a woman. But understanding that there's a difference between a normal menstrual cycle and a debilitating menstrual cycle, and that is not normal, is a huge educational piece. I talk about it, when I do things on social media. I'm like, wait, so what is normal? Because your normal might have you in the emergency room next week getting a blood transfusion.
Yeah.
I'm sure you were quite weak when you were bleeding that heavy, weren't you?
I was, and then so what they did was an iron deficiency test, and fortunately, I didn't have iron deficiency, surprisingly.
Wow. Yeah, because you were supplementing yourself well.
Yeah.
That's why.
Well, okay, so then this nurse practitioner is like, maybe they're fibroids. I mean, how long ago was this? Were you Googling these things?
It was when I feel like nobody was talking about it. Don't you feel like that sometimes? I feel like 10 years ago, nobody was having this conversation.
No.
And fibroids didn't just start yesterday, right? So her thing was, these didn't grow overnight. You've had them for a while, 16 centimeters, twice the size your uterus should be. And we started doing ultrasounds, because then when she said that, the question was, oh, wait a minute, what if they did grow overnight? Because that sounds like cancer to me. And she was like, okay, let's do a couple of tests. And I started seeing a gynecologist who basically followed me every 3 to 4 months, did repeat ultrasound, said this is not cancer. But during that time period, I started to have cycles similar to how you just described yours. And it became okay, this isn't bothering me, to like how you were talking about your iron levels. My iron was significantly deficient. I had to get iron transfusions twice a week.
Oh my gosh.
Like, yeah.
Wow.
I went from nothing, not even knowing they're there, to within a year, I was having cycles every 2 weeks. I was hemorrhaging, essentially. I was anemic. I was working 100-hour weeks with a hemoglobin of 7, and it should be 12.
Wow.
And it was a whirlwind, and I had surgery the next year. My husband was like, no, not going to do that. We have to get this taken care of.
When I turned 30, all sorts of stuff was happening to me. I think the first question was, do I have cancer? Is the fibroid cancerous?
Yeah, absolutely. Fibroids, by definition, are benign. There is a subset of tumors called leiomyosarcoma, which are cancer, that can be mistaken for fibroids, but they're super rare.
When I was talking to my fibroid surgeon, he was also saying, he was like, sometimes they just don't realize, and they have like a grapefruit size fibroid in their uterus. Why is that? Is it because it's not that hard, or?
Location.
Oh.
Yeah. Location is everything. So I've had patients. I've had a patient in particular I could think of who had a 20 centimeter fibroid. One fibroid.
I'm gonna pull out
20 centimeters.
I'm gonna pull out the measuring tape.
It's gonna blow you away. That was outside of her uterus and what we call pedunculated, and she never had any symptoms. She didn't even know it was there. She didn't feel the firmness in her abdomen. She had pain one day that sent her to the doctor, and that's when they found it. Location is everything. It's real estate when it comes to fibroids. We kind of get super focused on the size, but you can have a 2 centimeter fibroid in the middle of your uterus and hemorrhage, right?
I had to have the baby talk.
Yeah.
My husband and I have been kind of avoiding it for a bit. Did you have to have that conversation?
We did. And I feel like back then I didn't have a lot of support groups. There wasn't a white dress project. I didn't know that I had the potential to not necessarily feel like fertility was a now absolutely must do thing. And my doctor at the time did recommend that if I did surgery that I should think about getting pregnant shortly thereafter. And I did. I had my first child my 4th year of residency, 2 years after my surgery. And then I had another during my fellowship. I did a 2-year fellowship in minimally invasive surgery, to get back to your first question as to why I do this. And at the end of fellowship, I had my second child.
Oh, wow.
So I was
boom, boom, boom,
I
boom.
knocked them out.
Well, so can you explain why it affects your family plan?
Sure, potentially, because a lot of women don't even find out that they have fibroids until they get their first pregnancy ultrasound. Like, legit, had no idea it was there. They were small. They weren't bothering them. They get an ultrasound because they're pregnant, and it's like, oh, boom, the baby and the fibroid are playing together, and it's fine. So fibroids will be blamed a lot of times for infertility. It's not always the reason why, but it has the potential to be, again, usually because of the location. So when fibroids are in that cavity inside of the lining, the ones that usually cause a heavy bleeding, it can essentially take up space that the baby needs. Right? Literally, it's just right there where the baby needs to implant, and it makes it difficult to either get pregnant or stay pregnant. Increases risk of miscarriage, preterm labor, preterm delivery, late or fetal demise. It really does increase risk with pregnancy depending on that location.
Right. That's the point. If it is a real estate issue, you have 8 centimeters in your uterus. Your baby needs to be implanted somewhere, and then also they need to grow.
Taking up all the space.
They're like, what is this thing?
Yes. My best friend had a baby last year, and I did her ultrasound before she got pregnant. She was like, oh, just to check. I have the ability to get an ultrasound by my best friend. Let's just see. And I was like, oh, girl, you good. You got a little 1 centimeter baby fiber. Honey, that thing was 10 centimeters by the middle of her second trimester.
So it grows during pregnancy.
It grows sometimes. Yeah, because of all the hormones, all the massive hormones that can feed the fibroid in uterus during pregnancy. Sometimes it doesn't do anything. But a lot of times it will grow because of the hormones in early pregnancy.
Does anybody know why fibroids happen?
I like to tell people that fibroids are multifactorial. It's not necessarily one thing because there's a genetic factor, right? When we look at lineage and we look at family history, a lot of times we see it genetically passed down. However, all you have to do is be a woman. And all you have to do is have hormones, because hormones feed the cells of our uterus to grow fibroids. What we do know is that there are environmental factors such as the estrogen we consume in our diet. There have been even smaller studies that have looked at the things that we put on our skin, that's in our cosmetic products. For African American women that have been perming their hair for years, the paraffins that are in those actual chemicals, all of those things have been looked at in studies, smaller studies nevertheless, but have been associated with fibroids in the way that they grow. So yes, to answer your question, hormones have a part to play, but there are other factors as well. Vitamin D has been definitely well researched and linked to fibroid growth. So it's a lot. It's not just one thing.
So what are the stats? How many women typically get fibroids?
80%. 80% in reproductive years. And some sources will even say 90% in African American women. So you in the room with all your girlfriends, You're not the only one.
When you found out, was there anybody in your family or friend group that had it?
That's so crazy, because my mother found out she had fibroids after I found out I had fibroids. So it kind of went the opposite way. She found out she had fibroids and endometriosis after my diagnosis. I think what it did was it kind of perked her up to say, maybe this pain that I have on my side is something else that's going on that's more woman or GYN related. Maybe I need to stop ignoring it. And when she kind of honed in on it, she found out that she too had fibroids and endometriosis. So it went in the opposite direction. But that was an enlightenment to me, because I had never talked about it in my family before.
You are giving permission to question your pain.
Yeah.
The studies that have come out,
Yes.
how recent was that?
So it's not it's not recent. It's just that it's now better understood and better looked at. So even in the NIH field and world, they've been doing research on fibroids, not on necessarily large enough scales to be what I would consider impactful. We haven't done enough. Fibroids is most certainly a pandemic. For it to be a pandemic, we haven't really put a lot towards it in the last decade. Now we're hearing about it more. Vice President Kamala Harris has actually put forth legislature that is going to put money directly in the hands of research specifically to look at fibroids. And she did that just before her vice presidency. So it's coming around. It's coming around. We've been having a discussion, but it's kind of been a slow rev. Now it's picking up pace, and we're starting to see that this is definitely a pandemic that needs to be paid attention to, because it affects so many women.
That's what bothers me. If it affects 80% of women, why are we just finding out about this now?
Yeah. There's no foundation specifically for this. It's not cancer. It's not heart disease. And it's so interesting, because a lot of times if I've heard people ask that question before, and they'll say, because it's a black woman's disease. And so no one has really made it the headliner, right? It's not a black woman's only disease. It absolutely disproportionately affects black women, but I mean, it does not discriminate.
Hi.
I know, right? Right? Prime example. Right.
Hello.
I don't want to take anything or disqualify the fact that it disproportionately affects black women. But I agree with you. We should have been putting more into the efforts to find out about fibroids a long time ago. Because if fibroids or tumors were growing off of men's penis all over the place, and 80% of them, I guarantee you the research would have been there a long time ago.
Yeah, if they had an they're like, oh yeah, my penis was 8 centimeters and now it's 18. I don't know. Was your insurance able to cover that?
Yes, thank God. Yes, insurance was able to cover the myomectomy.
Man, because my surgery wasn't able wasn't covered under my insurance.
Sure. What did you have done, if you don't mind me asking?
Yeah, no, yeah, I had radio frequency ablation with Acessa. Yeah.
Yay.
Is that what you learned?
So I do Acessa now. I was the
Okay.
first doctor to start doing Acessa in Georgia commercially. And I'm just now, that was 2019 when I brought it to Georgia and started offering it to patients.
Okay, so Dr. Bruce Lee was my surgeon.
You can't get better than that. You cannot get better than Dr. Lee.
Because he's the one who created it.
Correct. Yeah, he's the one
How
who
did-
created it.
How did you know? How did you find out about him?
So when I was at AAGL, which is our kind of our organization for laparoscopic surgery, I saw the Acessa and saw the technology, and I actually it's a funny story because I kind of bogarted my way into their dinner with the CEO. Like, hello, I'm Dr. Hawkins. I do fibroids. Literally, like, can I get a glass of wine, please? It was good. I'm so not bold, with the exception of fibroids and endo. Like, this is when I get a little
warrior.
bold. Yeah, and it was something that I had my eye on and I wanted to learn more about. And shortly after that, the reps called me and the VP called and was like, okay, are you willing to do this fight? Because of what you just said, because of the whole insurance coverage. It's a hard process to bring something new into a market. And it was going to be a fight. And they prepared me for that. And so I brought it to, I told my hospital I wanted it. And my hospital said, yeah, right. We're not buying this equipment for you and only you. And it took a year for me to convince them.
Get out. That's how it works?
That's how it works. And now insurances are starting to do better with coverage. But there are unfortunately a lot of patients that are still like you that want Acessa and they are not getting the coverage from their insurance company. So it's still a fight. It's still a little bit of a fight, but we're getting there.
Why do you think that insurance companies don't cover it?
So Acessa is the newest technology for fibroids. And so since its FDA approval, the rollout has, I don't even want to use the word slow. They've taken their time, gratefully so, because this is technology that you want to be successful. So the insurances weren't forced to pay attention at the beginning. In places like Chicago and Texas, I've gone there to train because they're doing it in higher volume and numbers, and they've been doing it aggressively since 2012. But then when you look at Georgia and Florida and Alabama and Tennessee, all these places in the South around me, they didn't know about the technology, so we weren't forcing the insurance to even cover it. Now we're being a bit forceful. I've gone to Capitol Hill, I've talked to legislators, I've written letters to Cigna and Blue Cross, and I've been aggressive about pushing for it because I think that women should have it covered just like a myomectomy is covered. If you can cut me open and take out my fibroids or take out my uterus, because they will cover a hysterectomy any day, then you should be able to give me this option to do a minimally invasive approach as well.
A hysterectomy, which I didn't really know what a hysterectomy was before, but it is removing your uterus. And they're like, well, do you want to have kids?
Maybe.
I've never been so protective about my uterus before, but I don't want to remove that part of my body.
You're a woman, and that's an okay acknowledgement. I tell women all the time, let's discuss everything, right? Because even though I'm in love with Acessa, I can do a robotic myomectomy, I can do an open myomectomy, I can do all of these things. I have a buddy down the street that can do a uterine artery embolization. Let's talk about all of your options. And at the end of the day, if you decide that a hysterectomy is ultimately what you want to do and it fits your goals and ultimately gets you to where you want, then that's what we're going to do. But to start there,
That's drastic.
it's kind of drastic when you don't even know what all the other options are. It's kind of drastic, especially because, like you said and I said, our mind does kind of go to our fertility a little bit when we learn that we have fibroids. How could it not? You know what I mean? Even if you never thought about it before, you're like, oh, maybe now's the time for me to think about it. Yeah.
You're fighting for this surgery that also is a little bit of an unknown, but I guess what made you so confident that it is worth fighting for?
It was when I was able to do my own research into it, because I heard about it and it seemed like the fad thing to do, and I'm a young doctor, so I'm like, I want to stay on the cutting edge of technology. But I need the best for my patients, right? The outcomes, when I was able to actually look through the research, Acessa as a company was fighting for women, period. All of that kind of gave me the push to say, okay, maybe, I need to vet this out some more. Then when I could see the comparatives between Acessa and a myomectomy, which is what I had, right? And see that, okay, patients can actually end up with very similar outcomes as far as their pain, their bleeding, the recurrence of fibroids and things like that were looked at. I was like, okay, how could I not offer this procedure that, you could probably attest to? You go home the same day, the pain is not tremendous, you're back to work
Yeah, 3 days.
How could I not offer that? How could I not have that in my tool belt to be an option for women?
Mm-hmm.